The Utah Controlled Substance Database, or CSD, is an online tool that allows prescribers to view their patients' controlled substance prescription history from a computer or mobile device. Prescription information is provided by pharmacies for all controlled substances prescribed in the state of Utah. The CSD provides a prescriber with additional information, often resulting in improved treatment decisions. Let's take a look at how the CSD might be used. Mildred, a 74-year-old grandmother, slips in her kitchen and injures her hip. Mildred visits Dr. Taylor at the hospital emergency room and asks for pain-relieving medication. Dr. Taylor does not wish to overprescribe or prescribe anything that could conflict with Mildred's other medications. Before prescribing pain medication for Mildred, Dr. Taylor uses his mobile device to check her prescription history on the CSD. He discovers that she has never had a prescription for a controlled substance. Dr. Taylor makes the appropriate prescription. Because of Mildred's lack of experience with controlled substances, Dr. Taylor makes extra effort to educate her about their appropriate use. Mildred takes her prescription to Stacy, the local pharmacist, to be filled. Stacy electronically sends Mildred's prescription information to the CSD. Mildred's information is now available for her other doctors to review. The following week, Mildred chips a tooth while eating breakfast. Mildred visits Adam, her dentist, for treatment. Adam has run into prescription fraud before, so as he does with all patients, he checks her prescription history on the CSD using his office computer. The CSD informs Adam of Mildred's previous prescription from Dr. Taylor. Adam uses this information to make the appropriate prescription for Mildred's pain medication. Dr. Taylor's next patient is Mike, a young man complaining of severe pain, possibly from kidney stones. Dr. Taylor types Mike's name into the CSD and learns that Mike has recently filled several prescriptions for pain medication from a variety of physicians. The CSD lists the names of Mike's previous prescribers. If he wishes, Dr. Taylor may contact them to discuss the situation. Although there may be a valid reason for Mike's prescription history, Dr. Taylor sees potential for drug abuse or overdose. Dr. Taylor discusses the situation with Mike and proceeds towards the most appropriate treatment. Let's take a closer look at how the Controlled Substance Database system works. Using a desktop computer, laptop, or mobile device such as a BlackBerry or iPhone, an authorized user can log on to the CSD website and search for a patient by first name, last name, date of birth, or address. The user can then click on one or more of the search results to retrieve the patient's controlled substance history. The CSD then displays prescription information such as the drug, pharmacy, date, and prescriber. Getting started with the Controlled Substance Database is easy. On your first visit, you'll need to spend a few minutes creating your account. Simply visit csd.utah.gov. Your first step is to create a Utah ID account if you don't already have one. Next, you'll be asked to enter your date of birth, Social Security number, and DEA number. Our system compares this information to the licensing database. If your information matches, a PIN number will be emailed. This PIN number, along with your username and password, will be required each time that you log into the CSD. If your information does not match, or if you're uncomfortable using personal information online, you may create a PIN number over the phone during business hours by calling CSD support at 801-530-6628. The CSD is a valuable tool that improves your ability to deliver quality care. Use it to protect your patients, your practice, and to provide peace of mind. Log on to csd.utah.gov and get started today.